All right. Good evening, everyone. I see we have some viewers coming on here. Thank you for tuning in. If this is your first time joining me, I am Nurse Charms. I'm your host. I do my own live show. Right now, I'm just kind of random. I really don't have a set schedule. I'm getting there, just trying it out. It's fun. I love it. I love these Facebook Lives. I love the engagement, get a chance to, talk with everyone. So I have a guest here. I'm going to be introducing her in just a moment, but go ahead and share this video. Okay. It's going to be great tonight. You're really going to enjoy this, this Q&A. Happy Nurses Week to all the nurses who are watching us. Exciting time, hard times, especially working in the hospitals right now. But yep, Happy Nurses Week. Share this video. Just I always go over a couple disclaimers. We aren't being endorsed by anybody. All of our thoughts are our own. Nobody's paying us to say anything. No conspiracies here. You don't have to worry about that. All facts. Everything we say, is research and evidence-based in science and facts. We'll quote any studies that we're using or anything like that, or any reference that you can follow up. The comment thread is open, so if you guys want to ask some questions, make sure you engage in this broadcast. Ask lots of questions, and we'll get to them. We'll just ask them as we go. We won't make you wait to the end. So you want to just jump in something we're saying, drop a comment. We'd appreciate that. But again, share, and I'll just go ahead and introduce Cassia, Nurse Cassia. How you doing, girl? Happy Nurses Week to you.
Happy Nurses Week to you too. It's really nice to be able to do this on Nurses Week. So thank you for having me.
Yes, absolutely. So go ahead and introduce yourself. I always have the guests introduce themselves. I don't want to botch anything up, miss anybody's titles. So I'm just going to take care of that.
Okay, sure. So good evening.
I love your hair, by the way.
Yes, I like to switch it up. So I said I'll be crinkly today. But one on Facebook world, on my Facebook friends and family and coworkers. So if you don't know, my name is Cassia Black, and I am a registered nurse. And I currently work in community health. I work as primarily a pediatric home care nurse. And so my end for what I do in nursing services the community. So I usually see my patients within the home. So a little bit different from the acute level, more on a stable level. I've been a registered nurse for almost a year now. Before I was a registered nurse, I was an LPN for 5 years, and then I bridged over and became a registered nurse. So I'm happy about that. I loved my role as an LPN role. It was really good. I learned a lot in that role. So now it's nice to transition over to the RN role now as well. Yeah.
Okay. Awesome. So let's just jump right in. Tell us about your experience as a nurse.
So my experience as a nurse so far, I've had the opportunity to work in a couple different settings. That's the one thing that I love about nursing. I feel that it is such a diverse entity to work in. And the areas that I've worked in so far, I worked previously in corrections. I worked at Wayne County Jail before, and I worked at a assisted living facility before. I've worked in a memory care unit before, and then I've also done skilled nurse visits and then in-home care. And a lot of my patients that I see in the home, as far as the pediatric population goes, most of those children are they have trachs, they have vents, they have G-tubes. So we'll get into that aspect as it relates to COVID, I know later, but that's the population of children that I usually see. And adults, they're not trached and vented, the adult patients that I see. So.
Okay. Let's see. We have some people on our comment feed already. Veronique, hey, lady. Thanks for joining us. Go ahead and read it. Can you see it on the screen? Go ahead and read it and answer it.
I can't.
You can just read it out loud. And you can't see it?
Oh, I can see it. Yeah.
I can read it then. Okay, go ahead and read it out loud and then answer it.
It says, can you test negative for influenza A or B and still have COVID? So that's an interesting question. I haven't personally talked with anyone recently that I know that has either tested negative or positive for influenza A or B with COVID. As far as I know, it's a possibility, yes, that you can still test negative even with having COVID because of that strain. So you don't necessarily have to have the flu to test positive for COVID at all, because there are people who have the flu, but they don't have COVID-19.
I think Veronique, let me ask, are you saying this in response to that? There was something put out called Plandemic on YouTube. Did you get a chance to watch that, Cassia?
No, I didn't see that on. No,
Did you hear about it?
I didn't.
Yeah, so
I didn't see that on there.
Yeah, I'm just gonna call it a big conspiracy, but they were making some claims about basically this whole thing being a setup and stuff like that. And I mean, I don't really want to entertain that stuff, but I don't know if you were asking that question because some of the things that they said on that that documentary or whatever. But generally, I mean, you could possibly have, the flu and have COVID at the same time, but really you don't. They may give you a flu test, they may give you a COVID test to kind of rule out which one is it, because the symptoms are a little bit of the same. But as time has progressed and as we've learned more about COVID, we're learning that people have, GI symptoms, like in their stomach, people diarrhea, the loss of taste, so some of that is becoming more prevalent than, just the normal shortness of breath, cough and fever. Generally, it's going to be one or the other. Either you have COVID or either you have flu. But as we, some of the symptoms are similar, but I haven't seen any studies. So, I'm not directly working in like the ER or the hospitals, where they would be doing a lot of those testings, or like an urgent care clinic where they would be doing a lot of those testings, but at least not what I've heard. But good questions though. Let's see.
I haven't heard that one either, but I'm glad you brought that up about that article though, because I didn't see that. So that was good.
Douglas just says, hey, hey, what's up? Just giving us an amen. Thank you. We appreciate your support. We really do. Share this video, you guys. Let's see. Someone is telling us, thank you. We appreciate Cassandra. Thank you. Appreciate. And then we have, let's see, Joseph checking in. Hey, ladies.
Hi.
Hello. Thank you, Joseph. We appreciate your support. And then let's see. Okay, go ahead. I'm going to turn it over to you. Go ahead and read the question.
Let's see. I've heard, hi, Ashley. It says, I've heard that people who have heart conditions and cancer are at a higher risk of COVID. Is there any truth to that? I would say, yes, there is some truth to that. As far as anyone that has any type of pre-existing health conditions, a heart condition, or with someone having cancer, they're immunocompromised. So that does put those individuals at a higher risk, because one of the things that I'm noticing as I've talked also to other nurses who are in those acute settings, a lot of organs are being affected, like the heart, the lungs, obviously the lungs, but like other vital organs are being affected. And so that does correlate that people that do have pre-existing conditions would be at a higher risk, because for people who are compromised, that's really important that they do their best to stay protected, stay in as much as possible, because they're so what's the word I want to use? They're much more vulnerable to get the virus.
Right, because I mean, just think of it. So COVID-19, it affects your lungs, right? It's a respiratory you know, disorders. So you're fighting to breathe, right? You're fighting to get oxygen. Your blood pressure is going to increase. So that's another issue you're dealing with now. And then if you have some type of underlying heart issue, you know, if you have like, you know, high blood pressure, you know, high cholesterol, you know, clogged arteries, any of those issues, that's just going to, you know, increase your risk of, you know, having some type of adverse complication, because now not only do you have your lungs, you know, that you're trying to use to fight off, you also got your heart, you know, that's using its reserve to try to fight it off too, along with your immune system. So that's why, you know, all the physicians have put those people who have comorbidities at a higher risk category. And yeah, so I hope we answered your question here. Let's see. Somebody else has a question. Go ahead, read her question. Veronique.
Okay, it's based on me being sick in December, and I tested negative for both A and B and wonder if it was COVID. I'm glad that you asked that, because in talking with family members, friends, a lot of people, it seems, were sick between, let's say, November up until, you know, now. And a lot of people felt that they could have had COVID, but they just didn't know that's what it was. And they had a lot of the same symptoms. So, you know, it's possible that you could have had COVID, but that you weren't tested back then. And so, it's interesting that you say that too, because a friend of mine had recently shared that she had been tested, and she was saying that she was really sick back in December, January, and she tested negative for COVID, but she had tested positive for the antibody. So she felt that she definitely did have it back then, but just not presently now. So I really believe that so many people have shared their stories about how they've been affected within these past 6 months with similar symptoms to COVID.
Yeah. And just to piggyback off of that, that's why it's so important, you know, people who could be an asymptomatic carrier, is so important that we keep those away from the vulnerable people, because, you know, if we got people walking around, like I haven't gotten tested, but I haven't had any symptoms. So if I was to take a blood antibody test and if it was to come back positive, I would be totally shocked, because I'd be thinking like, dang, where have I been? Like I haven't even had or a cough or anything. So that would be very bizarre. But you know, with me just being asymptomatic, you know, I could spread it to 3 people, and then, you know, those 3 people spread it to more people. And then that's just how it grows. And that's, you know, how they talk about community spread. So that's why it's just so important for those vulnerable groups to really just stay home. I mean, it's almost the same thing as if, you know, you had cancer, you're going through chemotherapy and things like that. You know, it's that same category. That's kind of how you know, manage yourself until this COVID, you know, we get a vaccine or we get some type of treatment available.
Yeah.
But so let's see. Brittany, she says, hey, Brittany, thanks for joining us. And a lot of people just saying, hey. Yeah, we appreciate all your support. Thank you. Okay, so let's just jump back over. You know, Mother's Day is coming up, right? And per executive orders, you know, they don't want any large gatherings, right? You got to stay at home with the people you live with. They don't want you going to people's house visiting and all those types of things, because you know, we just talked about it, you know, the community spread, you know, people being asymptomatic and stuff like that. But that seems to be a little bit conflicting when you think about us going to places like these big box stores, like, you know, Walmart's, like Target, Myers. Like, I'll just share my own experience. You know, I was in Walmart, people walking around, you know, you're supposed to have the mask over your, you know, covering your nose and covering your mouth, right? Because the whole thing is COVID-19, it likes to hang out in mucous membranes. So, you know, that's your mouth, you know, eyes, nose, things like that. So the whole thing, you want to protect your face. So, you know, germs don't go through your mouth and then to your lungs and cause complications, right? But you got these people walking around, so it's just down there, and she'll do a little demo shortly. But yeah, so that's the type of thing going on. You know, you got people even take it, like for instance, I was asking one of the employees there, and this isn't a knock to, you know, Walmart or anything. I don't want anybody to think I'm bashing. I mean, these are just facts, observations. So I asked the lady, I was like, do you guys have any more carts? I didn't see any more shopping carts. She pulls down her mask. This is the employee, pulls down her mask, you know, to me. So, you know, is those type of things going on? People touching, you know what I'm saying? I see people touching their nose, you know, touching their face, all different types of things. And you know, reaching for objects. So how is that really safer than being around your own family? You know what I'm saying? So just kind of give some tips so, you know, people can avoid all of these things, you know, all of these, you know, take precautions so they can avoid, you know, exposure to COVID-19.
You know, I'm glad you said that. I mean, I can agree. I've seen the same thing when I've gone to the store. You know, it's such, this whole situation is so, it's new to the world, but it's not new to the world as far as the general public and what we've all been experiencing. And so I've seen a lot of the same thing, you know, with the gloves, with the mask. And I think because people are they're not used to having to wear masks and things like that, and in dealing with this situation, a lot of people they just don't realize it. Like you said, people are wearing the mask down here, or if they have gloves on, they're coughing and sneezing in the gloves, and then they're not realizing, or they do realize when they're touching things, and then touching the debit card machines, or wiping their face, or putting their hair back.
Right.
All these little things that we know as clinicians, if we have on gloves, we can't touch our face. Like, don't touch anything, you know, when you're in the middle of a task that you're doing. So it's interesting when you think about being around family, being around friends, and then also being at the store as well, because you're still around people. But if those are situations, I think it's important to control what you can control as best as possible. Like with being in the store, they haven't come up with a situation really, or a setup where you're not around that many people, so to say, but in the environments where we can control who we're coming in contact, I feel that's really important, because that's helping. It's helping cut down on being exposed and being around other people, because we still don't always know who does have the virus, if they're asymptomatic or not. And so I think it's important, though, to still protect yourself, even in lieu of the holiday. You know, we love our mothers, our sisters, our aunts, our grandparents, but it's important that we, you know, Skype, FaceTime. I don't even know if people still use Skype, but FaceTime, like, you know,
right.
It's important to just utilize these other outlets that we have to, you know, express our love to our loved ones, and Zoom and things like that too, you know. So, but it's interesting.
Right. Ashley, she says, hey y'all, Black Nurses Matter, hashtag. Thank you for watching. We appreciate
yes, they do.
Veronique, she's so engaged. We appreciate you, all your questions, Veronique. Go ahead. Go ahead and read the question and answer it.
Okay, it says only immunocompromised if they are receiving chemotherapy. Oh, so you're saying, are you only immunocompromised if you're receiving chemotherapy? Is that what I think that's trying to say? Only.
Yeah. Yes. If you're receiving chemotherapy, yes, you're considered, because normally when you have cancer, normally your white blood cells are low. So when your white blood, those are the blood cells you need to help fight infection. So yeah, you would be in a category. Are receiving chemotherapy, they would be in that vulnerable category. Let's see. Hey, Trevor, go ahead. Read that.
I seem to be getting conflicting info. Can COVID-19 be carried, spread by pets? I would say the same thing. I've been seeing conflicting information about that with pets that have tested positive for COVID. I've seen some articles about that. I don't know of any cases here in the U.S. specifically specifically. I know I saw there was a case like in China that they were saying that there were some dogs that had COVID-19. I'm not sure if people are having their animals tested or what really the consensus is so far that I've seen in the US. I know I did see that article about China though, with the dogs or our pets.
Yeah, what I heard, like, is very, it's very possible for, like a owner, if they're positive with COVID-19, they're coughing and sneezing or talking or whatever, and it's possible for those droplets, depending on how potent the viral load, what stage they are, like if they're maybe at the beginning stage of having COVID, and the viral load is very high and strong, and they're really contagious. So those droplets, whoever they come in contact with, they'll infect you. And if it's their pet, I mean, if you just kind of think of it, yeah, hypothetically, yeah, it's possible, but I don't know that pets can give it to a human. You know what I'm saying? Like how, everyone says that, this disease came from bats. We don't know if it was in a lab or natural. The World Health Organization, they're saying it was naturally occurring, but Trump administration, they think that it was made in a lab. So we really don't know. We really need China to be honest about what really went down. You know what I'm saying? We really don't know, but I don't know. I don't know how, I don't think cats and dogs can give it to each other.
No,
I don't know. I can't. We'll have to circle back, but you're right. There is a lot of conflicting information on that, but I don't think that cats can give it to humans. I think that humans may be able to give it to cats, but we'll have to circle back and and do a solid answer on that. But thanks for your question. Let's see, Veronique, go ahead and read that.
Because there are cancer patients with strong immune systems. And I would say, yes, there are, cancer patients that do have strong immune systems. But even with that, being a cancer patient and receiving chemotherapy, you still are, that person would still be at a greater risk for contracting the virus. So it's still best that they protect themselves and stay away from the general public as best they can. So, but we could say that with any disease, someone that could have a cardiac disease, high blood pressure. One person that has high blood pressure may be really maintaining their blood pressure really well, and they're not, as bad. Or a diabetic patient, you have some of those patients who are maintaining their blood sugars really well. They're doing good. Then you have others that are more brittle. So I agree with that. Some are strong, but you still need to keep yourself protected, or your loved ones who are cancer patients need to keep themselves protected as best they can.
Right. Claude just says hello.
Yes.
Finally joining in. That's okay. Better late than never.
Yes.
Autumn.
Yes. Hi, Autumn. If you guys,
thanks for joining.
Yes, send the questions.
Yes, if you have any questions, definitely ask them, because we'll be on here answering questions. Go ahead, you can read that, Veronique.
Okay. Veronique said, I knew something wasn't right. Went to urgent care 2 days in a row. I was given steroids and antibiotics. I was sick for 2 weeks. So was this back in December? I wonder when she was saying this wasn't recently, was it, Veronique?
Yeah, I have heard that steroids have been used to treat COVID-19, because that's kind of used in general, bronchodilators and all those things. Those are some of the similar drugs given to people having an asthma attack or something. It's all to open up your cells in your lungs, basically. So yeah, I have seen steroids given. Antibiotics, usually they give that you give a drug to treat a bug. That's how I learned it a long time ago. So you really don't just give an antibiotic, just in general. So they usually do a culture or some type of specimen and find out what specific bug you have, and then they write a prescription for it. But I have been seeing, you know, people hear about Z-Pak all the time, and I have heard people, you know, give Z-Pak. I mean, that's kind of controversial because, like, your normal immune system is gonna fight it off. That's why it's like not really anything when you get colds and when you get flus. You just kind of a natural process. You treat, you know, throat lozenges, stuff like that. You know, you could humidify, you know, for your nose and sinus passages and stuff like that. Use a humidifier or whatever. Drink tea and stuff like that. But yeah, they generally don't give antibiotics unless, you know, they have a culture. But you may have gotten a Z-Pak. I have seen that, and in some of the severe cases of COVID-19, they were given like the hydroxychloroquine and the zinc, right, and the zinc and the Z-Pak. They were given that to treat it. But now there's some studies that show that hydrochloroquine is not having any effect, and it's harmful. So I know that's not FDA approved. Only the remdesivir is FDA approved. But let's see. We got another question. Want to go ahead and read that?
I knew this probably was going to come up at some point. It says, what are your thoughts on Blacks contracting, dying from COVID-19 versus our white counterparts? You know, I had thought about before we had got on, was this going to probably come up in our conversation? And, you know, it's interesting when we look at the Black community and how we are affected with diseases. And I will say in our community, there's two things. The first thing I would talk about would be our awareness and the information that we're getting, that we're actually taking it and implementing it. And that's not to say that that's just our community, but whenever you are dealing with any type of situation, it's important that you are taking the knowledge that you have and you're implementing those principles. So for example, if we know that right now social distancing is something that's a key component to helping cut down the numbers on the virus and to help decrease the spread. So counteracting that would be having a party at someone's house, or having a large group of people come over, or having a party with a bounce house with kids on the weekend, things like that. So I'll say that it's important sometimes in our community that we're taking the information for what it is and we're implementing the guidelines that the CDC is giving, the guidelines that WHO is giving, the World Health Organization, and taking that and utilizing it and doing the best we can to carry that out. So that's the first part I'll say, because that's the first part I'll address. The second part I'll address, especially from the community health aspect, some people, even now in 2020, don't fully have all of the resources that some people do. I'll say, for example, for students that are at home right now and homeschooling, I even saw this story on the news. There was a woman on the news talking about her children, how she only has her cell phone as a resource for her children to use. She had a couple children and all of them have to take turns getting on her phone to do their schoolwork. So for some people in our community, they may not still have a lot of access to, everyone doesn't have a laptop at home. We may think a lot of people do, but some people don't. So I think part of that too is not having some of those resources that we need technological wise too, to keep ourselves abreast, to keep ourselves updated on what we should be doing. So I feel it's twofold. It's part of what people, it's part of using the knowledge that you have and implementing it. And then it's also for those who don't have really what they need essentially. So it's a twofold thing. It really is. It's twofold.
Yeah. Good advice there. Thanks for that question, Ashley. That was a great question. Jasmine is here. Happy Nurses Week to you, hon. Thank you. Appreciate it. So let's just get back in to our discussion. So why do you think there's so much fear when it comes to COVID-19? I mean, they have one FDA approved drug, which we talked about, the remdesivir. We know that social distancing is helping. We know that there's over 90% people who recover. I'm saying? We even know that there's people who have it and don't even know that they have it.
Yeah.
So I guess just right, people walking around, because there was a study in California where they found, like back in November, December, like the late part of last year, that people had all these symptoms and they didn't even realize, it was the COVID-19 or whatever. But just saying all that, like, there's really a lot of fear. People think that this is a death sentence or whatever, and I mean, it could be, it kind of depends on the status of your overall health, right? But anyways, just kind of talk about, like, why do you think people feel like just have so much fear, and help dispel that, and tell the facts and the realistic truth about COVID-19.
Okay, so that's a very, very good point that you brought up, fear, because a lot of times when we are facing a situation, especially something to this magnitude of pandemic, and a situation that essentially caught a lot of the general public, the world, off guard. Of course, we didn't know that people, could have had this months ago, but knowing that it just hit all of a sudden, and so many more cases after case after case was populating, I could see in a natural standpoint how fear can come in and grip people. I see a lot of different posts, a lot of different people that I talk to, from healthcare perspective to a spiritual perspective, and just I can see how fear could grip. That's a natural emotion. But one important thing to remember with COVID-19, despite what it's doing, it's not a death sentence. And that's the first thing. Now,
Right.
Unfortunately, we have seen it has impacted everyone differently. But even in a storm, we know that storms don't last forever. And this is
Right.
a storm that the world is in right now, but it doesn't last forever. And so I would stress for people to know that, despite that this virus is going on, to still know that that it's important to do what you can to social distance, do what you can in the natural by washing your hands, by wearing your mask, but to know that despite what we see, that this situation is going to get better. It may look like it's not in some instances, because everyone, each week, I know we may see a post that someone has passed away, but to counteract that, I've also seen a lot of posts where people have recovered. And so I've been trying to share that as well on my page. When I see someone say, hey, I recovered from COVID-19, or hey, I had mild symptoms, because one thing when we're in this season, in this situation, it's so important that we reflect on the good news and positive news that we are hearing with this virus. And one thing that I can say personally for me that has
helped, it's just not one-sided. So it's just not one-sided.
No, it's not one-sided. And I think it's still really important for people to, as best they can, because everyone is processing things differently. Everyone's mindset right now is not at the same place as another person. But I would just share with people that despite this virus, we know that it is not permanent, that as we see the numbers are going down, and it's just something that we have to continue to work through, but it's something that it's not going to last forever. It may change some of what we feel as our new normal, moving forward. But I do want to encourage people that despite what we are seeing right now, that, we don't have to fear, even though it's a fearful situation. And I say that because I think about my faith, and I think about how I lean on my faith as something to help in this situation. Everyone has various faith backgrounds, but for me, my faith is something, and my connection that I have with my church family, the relationship that I have with the Lord is something that really is a staple for me. And I know a staple for a lot of people, because sometimes when you look around and you don't know what else to turn to, a lot of people look to their faith as that beacon of light and that beacon of hope in these types of situations. So
yeah, absolutely. Gotta have a strong foundation, right? And sanity, it's a sense of sanity and mental health to, get you through this. Trevor, he says, thank you for taking my question and thank you for the information. You are welcome, and we thank
very
you for
true.
watching and joining us. Trevor, he just agrees with us. He said, very true. Thanks.
It's so true.
Let's see. Jessica, she says, go ahead. You can read that and answer it.
It says, if you've had COVID-19 before, rather mild or severe, is it possible to get it again? And that's interesting, because when you look at different articles that are coming out, some that I've seen, when you think about peaks or seasons, if it's going to come back again, I kind of say with the flu. Like with the flu, you know how there's different strains of the flu. And I'm not sure necessarily with the COVID-19, because it's so new, is there going to be multiple strains of the virus? Because if there's multiple strains, then to me, that would say there's a possibility that maybe someone could contract it again. Because it's not the one strain of the virus. Because like with the flu, sometimes people get the flu 1 year, they don't get it the next year or something, and they maybe could get it again because there's a different strain of the flu. So I would say that it could be a possibility that a person could get it again if there's a variety of strains of COVID-19.
Right. Yep. And as we know right now, there's no research that says you cannot get reinfected. From what we've seen, some people have still tested positive up to 30 days. The timeline that they give you, if you have COVID, you're positive, you quarantine for 14 days, then, you could come out of quarantine and you're fine. But really what they should be doing is retesting you to make sure that you're negative, because if you retest positive, then you shouldn't be coming out or doing anything. So yeah, but they did some studies and they found that these people were still testing positive. So it's like, did they come in contact with the virus again, or did it just never leave? And that means that 14-day period should be extended. It's like, these are all things that just has to continuously be researched until we have some definitive answers. But yeah, that was a good question. Let's see. I know, that's a good question. We like questions.
Yes.
Autumn,
Yes.
she just says, nurses. Hey, thanks for supporting us. Let's see who's here.
Hi, Janae. Good evening.
Good evening, Janae. Thank you for joining in. Again, you guys share this video, invite people to watch. Go ahead and read that.
Okay, so Autumn's question, it says, okay, sinuses are often mistaken by COVID-19 symptoms. How can you differentiate the two? Well, one of the things, of course, in alignment with the symptoms that we're going by, the high fever, the shortness of breath, I would say you would really essentially kind of have to get tested really to determine definitively if you have the virus. If you're seeing, okay, that you, because one thing, someone could have a common cold even now, and it's not COVID-19. So it's important to, in seeing the symptoms that you have, in knowing what the symptoms of COVID-19 are, correlating those symptoms, and then also consulting with your PCP as well, just to see, because really you would have to get tested definitively to know if you do in fact have the virus. And that's one thing, that could open up too, when you think about people who have gone to hospitals and how we've seen the stories of people, either being turned away or things like that. So it's really important that people that need to get tested are getting the testing that they need to rule out the virus.
Yes, great question. Go ahead. You want to read that?
Yeah. It says, are there holistic ways to combat COVID-19? There are holistic ways. Just like taking our vitamins, zinc and vitamin C. I mean, those are not medications, but those are vitamins that have been shown to help with our immune systems and help with this virus. So even people drinking tea, I can attest to. I've been drinking tea. I've been taking zinc every day. I've been taking vitamin C every day, along with other vitamins that I was taking already. I have seen, and I know you've seen it too, Charmaine, with people taking like the oranges and lemons and using that as like a nebulizer treatment, if you will, to help, to help the nasal passages. I mean, oranges have vitamin C in it. It's coming, So, I mean, I think that especially I would say with the vitamins, that is the holistic way to help, with COVID-19. You're resting, that's important too, for people getting your adequate rest, sleeping, trying to be as relaxed as possible, keeping your stress level down, because stress does not help our immune systems either. So, that's not really a holistic thing, but just helping, keep down our stressors is really important too. So definitely with the vitamins, I would still recommend people to take their zinc, take their vitamin C. If people are finding that the lemon and the orange, steam treatment is helping clear their nasal passageway, they feel it's helping them, then, I mean, it cannot hurt essentially to do that. So if that's something that is also giving a comfort for people, I would say, that's fine too.
All right. We got another question. Go ahead.
Is it true that sunlight kills the COVID-19 virus? Am I okay going out for 2-a-day walks? Okay, well, that's a good question. I have not specifically seen sunlight as a healing measure for COVID-19, but certainly getting outside and getting the sunlight, it helps. Anytime you see light outside, it makes you smile. So it's good that you can get out and get that exercise. I can attest to saying that sunlight kills the COVID-19.
Well, I can answer that portion because, they have the White House press briefings and, all the top experts in there, they get up there and talk. And then they, present data and studies. And actually, they did say that just a couple weeks back. They said, there's new data that shows that, ultraviolet sunlight rays, heat and humidity. They said that basically when the virus is faced with heat, like literally like, a minute, it dies. So that's been the rationale behind why they've been saying like, any jobs that are performed outside, that they can, as we open up the economy, that those types of jobs are acceptable. Just kind of anything that's outside, with sunlight, because, we know that the virus is spread through droplets talking. So, if there is any type of contact with an affected person and their droplets, there would be a high chance that the virus doesn't really survive long. I think it cuts, when you're in sunlight, they said that it cuts down from 3 hours to 1 hour. That's how long the droplets will survive, if aerosolized, basically just coughed out. So that is some promising. So yes, definitely do. If not for the virus, just do it for your cardiovascular. So yeah, definitely get outside and enjoy. But if you are in contact with people, definitely wear a mask. If you're in the outside by yourself, a park or something, and people aren't around, then yeah, it's okay to have off. But as soon as people start coming into your inner space, that's going to be less than 6 feet, then I would say make sure you have on a mask.
Yes.
Sarah, hey, Sarah, she says, hey, girls, keep spreading the good word. Yay. Thank you. We appreciate you for joining us.
Yeah.
Let's see. Kiki, she is just co-signing us. So thank you. We appreciate. And let's see.
Well said. Mm-hmm.
Yep, she's just co-signing. Thank you. Thank you. Thank you. Happy Nurses Week, nurse.
Yes.
And oh shoot. Okay, so let me get back into our Q&A. So one of the things I want to talk about, as the virus enters our body, our own immune system is designed, how God designed our immune system to attack viruses, right? That's, saying that if you have a normal immune system, right? Mm-hmm. But, this is America. People do their own things. We know that a lot of people, are eating unhealthy, junk foods, not exercising, not drinking enough water, drinking lots of alcohol, smoking, vaping. They're doing all these things to their body. So could they be putting themselves at risk for if, they did get the COVID-19? Would that put them, essentially in a higher risk category if they're not really taking care of themselves?
I mean, it's possible. I feel, anytime we're COVID-19 related or not, if we're not taking care of our temples properly, we could predispose ourselves or make ourselves more susceptible to different diseases, like with smoking. A lot of times, some people really don't know just how bad smoking is. It is a vasoconstrictor, and that is not good. You don't want anything constricting any blood vessels or anything like that. And what is blood? I mean, that it's something that carries our oxygen. And what are our organs need? They all need oxygen. They all need that blood. So essentially, when we're doing things such as smoking, we're really affecting our overall health. That's just an example. So it's so imperative that we do as best as we can diet, having a balanced diet, exercising, eating, drinking our water, cutting back on the alcoholic beverages, cutting back on the fatty foods, because it really does help in our overall health, and it helps us to, to decrease, that possibility of catching any type of disease, aside from things that are genetic. But it's definitely important that we, especially with this situation now, if it hasn't encouraged people to revisit how they're living, it should, because it's so important and imperative that we are taking care of our bodies. So hopefully, even in this situation, it's causing a lot of people to reflect. It's causing a lot of people to reflect on their lifestyles of how they're living and eating and stress and work. So, even in this situation, there's some positive things that we can look at where we can really, because now people have more time, so they can really sit and evaluate, okay, I really should, start exercising more. I really should cut back on smoking. I really should cut back on alcohol. I really should cut back on my stress because it's wearing on me. So all of those things, you can, put yourself at a greater risk if you're not healthy, because all those things compromise your immune system when you're smoking, when you're drinking, essentially. So it's important to keep our bodies as healthy as we can. And so I would say, yes, you would put yourself at a higher risk when you're not healthy,
Yeah. So listen, what are your thoughts on testing? Because we know that testing is just a moment in time. You know what I'm saying? You can get tested, say you got to go into work, and in order to come back to work, you got to get tested. So, say you go get tested at 8 a.m. or whatever, then you find out your results are negative, because, they have these instant tests now. You can find out like 15 minutes or whatever. So you're negative, right? So you go to work or whatever. Then after work, you go wherever you're around some people, whatever. Then some of those people you're around, say they had COVID. So next thing you're at risk for having it. So my point is that, like, it's only a moment in time. Literally, you have to just test people almost every hour, every day to really, keep a handle on, are you staying negative? You know what I'm saying? So knowing all of that, like how realistic is that? How valuable is testing? Because like testing everybody. There's 331 million Americans or whatever. So is testing everybody going to be the solution to this? Or should we strategize and test those people who are vulnerable? Vulnerable means like, people in inner cities, people in nursing homes, people with the comorbidities, people with, just the vulnerable populations, high risk, the elderly. Shouldn't those people get tested so we can figure out, who has it? So, we could isolate, and if they need to get some treatment or whatever, versus just because like I haven't gotten tested. I don't know if you've gotten tested, but I'm not going to get tested. I feel like they can use that for somebody who really needs to get tested, because like I've said, like I haven't had any symptoms. What benefit would testing me? And then say I go out somewhere, I could just be exposed to it still. So I don't know. I just want to know your views on testing, and what do you think the solution should be for that, or the strategy should be for testing?
Well, okay. So one thing I'll say about testing, and even as it relates to nursing, one of the things that we know that we do a lot of times is we prioritize.
Wait, have you been tested? Have you been tested or no?
Okay, answer that question first. I have not been tested yet.
And why not? Why not? Why haven't you been tested?
I have not been tested. Well, two things. One, I haven't had any sign or any symptoms of COVID-19. One. Number two, I'm glad you brought that up, because I had just gotten an email from the state last week, and they were talking about testing, and they were saying now that they really wanted to implement anyone who is an essential worker or anyone who is leaving out of their home to be tested. And they were talking about the test kits, and that was something that I was talking to my employer about, and I have to follow back up with them, because essentially I am still going out giving clinical care, personal care. So I feel that it would be in my best interest at some point to get tested, because I still am working, giving direct patient care. But I have not been tested yet. And for those of you who have seen me, I do not have any symptoms of COVID-19, but I have not been tested yet. But I know that that is something that is going to be happening in the future. It's just a matter of how they're going to work it out with having the nurses get tested. But I did get that email from Laura last week that they were saying that.
So is it valuable to just do a broad blanket, send test kits to everybody's house, like, what's the strategy?
I definitely think that it's important to prioritize, number one, when we look at testing. So as you were saying before, it's important, number one, to look at who is most vulnerable and susceptible to contracting the virus. We need to look at our healthcare workers who are giving direct care, not just healthcare workers, but anyone who is still in a healthcare facility actively. So I think the first thing needs to be is, of course, to prioritize, number one, those workers who are coming in the most direct contact with people, the elderly, those who are most susceptible to contracting COVID-19. That's number one, I would say. I do believe that at some point, somehow, a lot more of the general public is going to have to get tested. I know that when employers do open back up, and they're going to slowly but surely have employees get back in the office setting, they're going to, I know companies are going to want their employees to get tested. I know in that email that the state sent out, they said whether you have mild, severe, are symptomatic or asymptomatic, they want essential workers to get tested. So I know that's something that I'm waiting to coordinate with my employer with about getting tested myself. Now, also, when you think about the 381 million people around the world, is it really how efficient or realistic is it going to be maybe that everyone is going to get tested? If you look at reality, I don't know if everyone is going to get tested. I don't even know if that will be possible in a long term. You can look for a lot of people to get tested, but realistically, I don't know. Everyone probably will not get tested for the virus. Some people will, some people won't, but the whole entire world, I don't know, and I don't really see that.
Because you have to look at it like testing kits cost money, right? You know what I'm saying? And then you have to send them to a lab, you know, that's resources, that's employees, people. So I mean, it's a lot of moving parts to that. So I don't know, but I mean, yeah, I can see employers, you know, certain jobs, I can see that, you know, they may want to get tested. So CDC, we have talked a little bit about this, but you know, they give their stats that 8 out of 10 positive cases are, you know, the elderly, and they are you know, the vulnerable. So with knowing that, you know, now that this virus has been around since you know, December, whenever they found out Wuhan and all that stuff, so now that we see the people who are the most you know, getting the virus the most, so shouldn't we have those people, you know, stay home, and then everyone else, you know, just kind of goes on with precaution? So how do you feel about that? Because I mean, here's the thing, at the end of the day, I mean, we're not seeing any light at the end of this tunnel anytime soon. You know, they're saying it's going to be another peak. They're saying that, you know, it's not going away for another, you know, 2 years or so. There's no vaccine. I mean, they're trying to fast track vaccines, but there's no vaccine that's ready to, you know, to sell or whatever. So what is your solution for, you know, restarting the economy?
You know, as far as restarting the economy, it's got to be obviously a gradual progression. We can't just go back to just boom, you know, life as we know it or knew it, because life as we knew it has shifted right now. And so we can't just jump back and go into things with the same mindset and with the same intervention, if you will, as we did before. So,
but how does this one size fits all approach work? You know what I'm saying? Like somebody like me, no comorbidities, I'm healthy, I'm in the house. You know what I'm saying? And like my business suffering, my bills ain't getting paid. I'm just saying, you know, hypothetically, but yeah, I am. But you know, people can't feed their families, all those things. So all these people are suffering to protect these vulnerable groups. You know what I'm saying? So how is that really fair? And how can we move forward, you know, with this one size fits all approach? Everybody stay in the house, nobody come out except the essential people. Those people who are essential, they're still going to Walmart and everywhere else, and there can still be carriers too. So I really don't understand the rationale behind that. Some people can, people can't.
You
know,
it's
like, why don't we keep all the vulnerable people home?
You know, this whole situation that we are facing currently, I feel like we're kind of navigating through the unknown, and we're really taking things kind of as it comes and day by day, because we see in our media outlets the different information that we're getting. It's, you know, it seems like I don't want to say the word trial and error, but it's like we're really gathering information and then coming up with solutions as we go, so to say. And things with the virus, as we've seen, have changed, even with just the symptoms, because before the emphasis was the shortness of breath, it was the fever, and it was the coughing and things. But now we're getting in the GI and symptoms with the diarrhea, and then it's the body aches and the chills, and then it's the appetite suppression. So it's like, with things changing with this virus, you know, it's like we're trying to adapt and make changes as we go along. You know, I feel like there's not necessarily, when we look scientific wise, yet just a clear cut definitive answer. It seems like we're navigating through this situation as more and more information and more studies are coming out with how we're handling it. But, you know, a lot of people are feeling what you were saying about, well, you know, I want to get back to work. I want to get back out there. We can't live like, you know, this forever. And essentially the world can't necessarily stay just like this forever. Eventually, the world is going to have to open back up, but it is going to have to be something that is gradual. And it's so imperative now that in this time where we are kind of slowed down, it's important that our researchers who are out there are trying to work on the best solutions so that when things do open back up, we can combat it as best we can, because things change so much with this virus, and we just are trying to, like, it seems like the world is really trying to move along, as best they can with it. But for people who are feeling that way about wanting to get back out right now and wanting to get back to work, and I can see why, because this situation has affected everyone differently. Everyone's streams of income is not what it used to be, and I can see that if people are not getting the resources that they previously had, there's some anxiousness there. But I think that it's so important that we take gradual steps in getting back out, in opening businesses, in getting back in our communities. But it's really, it's just it's interesting. I really feel, and it's no clear-cut answer yet.
Yep. I just want to hear your thoughts. Okay, so go ahead, read Jasmine's question.
Okay, it says, what are your thoughts on people stating if we continue to wear masks and excessively clean, eventually our bodies won't be able to naturally fight against foreign microbes that try to enter?
That's a good question.
And that is a good question too, because we know that our bodies have like that natural flora, and we know that our bodies essentially, need to have some level of exposure to those bacteria or pathogens, if you will, because that does help build our immunity. So that is a good question. If I can't necessarily say that if eventually our bodies won't be able to fight foreign microbes. I think that as far as with COVID-19 for right now, still wearing the mask, is good, still washing our hands. I can't say yet for sure if I feel that it'll change how our bodies, our defense mechanism, our immune system, if you will. I can't necessarily give it a answer.
I'm gonna jump in here. Your immune system weaken as you have disease, right? So naturally your immune system is, it's churning every day, as you do things like get enough rest, as you do things like keep down stress, as you do things like eat healthy, exercise, all those different things, they help to keep your immune system healthy and prepared daily. So should you get a virus, so I know there's been some speculation, even some, physicians have even said, well, your immune system weakens if you don't, it naturally weakens. I don't know that there's any scientific evidence to prove that. And Cassia, it sounds like you don't, you're not buying into that either, right? So
I haven't seen study. I mean, honestly, there's so many things we could really honestly talk about COVID-19 for hours and hours and hours, because look at how many things are getting pulled out of this conversation, different pieces of information that's coming out with the virus. So I can't say research wise I haven't seen it, but I guess it's something we'll continue to see as this person.
So we'll just go through these questions here. Jessica, she says, can you get COVID-19 again if you've had it already? So that is like the $1 million question. There's no scientific research that says you can't get it a second time. So we just don't know. So in the meantime, just keep preparing yourself. Even if you got it, you tested positive, continue to wear your mask, continue to hand wash, social distance, all those things, because, there's nothing that says you won't get it again. So better safe than sorry, right? You agree with that?
I agree. It's best, hands down, to protect yourself, because at least if you know that you already are protected, that you already have that first line of defense against potentially getting it again. Oh, there's another question. Ashley says, how soon do you think a vaccine will be created? I know I recently saw on the news as recently that they were talking, Pfizer, which is a pharmaceutical company, was talking about they've been doing testing currently and having volunteers volunteer themselves for testing out a potential vaccine, and that it's possible that it could be available in the fall for emergency use. So, so the fall is what I saw when I had watched the news that Pfizer, I know specifically Pfizer, I saw is working on that vaccine. And it could be as early as the fall. I know they said for emergency use. So I don't know if it's going to be ready yet for something to disperse to just everybody right away, but I know they specifically said for emergency use. So the fall. As far as
there's a lot of companies. There's Johnson and Johnson's working on a vaccine. There's people out of the country, so everybody's trying to, I know the NIH. There's a lot of people that are trying to get the vaccine, ready, but we have to make sure it works. We have to make sure it doesn't get people even sick, even sicker than they were. So yeah, they have to get all those kinks out. Autumn says, what are options for covering your mouth and noses that are sufficient for those without masks?
Good. Well, that's a good question. It's so important. It's so important, that if you're not having a mask on the proper way, to cough or sneeze. And one of those things is, if you do have to cough or sneeze, it's so important that either if you don't have like a napkin or a tissue, you can cough or sneeze in that. If you don't have something ready available, your clothing, you can cough or sneeze inside your clothing or in your arm. But it's so imperative that no one cough or sneeze directly into their hands. But if they do, it's imperative that you wash your hands or sanitize your hands after.
Yes. And Autumn, literally go to a dollar store and you could get yourself a bandana and you could just use that. You can use a scarf. The whole idea is to just keep mouth covered, because these big box places and stuff, and lots of people, you don't know their status or whatever, people are coming out and they positive and they know it, they don't care, or they asymptomatic or whatever. But the whole idea, you want to just protect your face. So like I said, bandana, like if you can't get a surgical mask or anything like that, just whatever you can use. I've even seen somebody said a shirt, but I wouldn't be walking around with a shirt over my mouth.
As long as something, know everyone, like you said, doesn't have access to surgical masks, medical masks, having some type of barrier, is so imperative.
Right. Kiki, she says, I know 2 people that tested positive twice, 2 months apart. Yep. See? So, I mean, were they reinfected or did they keep the virus still in their bloodstream, So, I mean, yeah, it just still needs to be more research. We really don't know. Ashley, she says, what are your thoughts on America opening up soon, but the death toll is at an alarming rate? What can we do to protect ourselves when Michigan opens back up? Yeah, I think you talked about that a little bit. Basically, just to protect yourself is the hand washing and social distancing, because the biggest thing that, the droplets are spread talking, coughing, sneezing, any of that stuff. So you want to just stay far back as possible from all those people. I guess I'm one of those people who are against the, just one size fits all, keep everybody in the house. I'm against that. As a nurse, my position is that the vulnerable people that should home, we named all those groups earlier, and everyone else go out and use caution, use gloves. So when you are at these places, Walmart's, Kroger, I know Walmart, you touching things and you have on your gloves, you wear a mask. So that's just personally how I feel. I know the CDC now all of a sudden they're saying stay home. So they change all the time.
It changes so much. That's what we were just saying. All the information, you could get information one day and then the next day a new piece of information comes out. But, as far as to also piggyback on your question, Ashley, you still need to use as far as your personal best judgment. I mean, I know I've talked to multiple people, and a lot of people don't feel comfortable yet with going back out, even when the state does open back up. A lot of people have to and will, I know, make that personal decision if they choose to still distance. I think that it's in getting back out when Michigan does open back up, I think it's still good to be cautious. I think that with everything that's
Absolutely.
going on, you don't just want to jump back out and, have a dinner party or something like that. Only really
Right.
out amongst people when it really is necessary. But anything more social, of course, that needs to be cut out. But I think a lot of people are definitely still going to, not be in a rush to kind of get back out just yet. So, but I think it's good to still be cautious, even when the state does open back up, to be cautious when you are out and getting back in the public.
Yeah. I'm just trying to get through the rest of these
Oh, yes.
comments because
Yes.
yeah. Yep, absolutely. Wait a minute. Oops. Hold on. I gotta go back up. I skipped something. Let me go here. Wait. Oop. How did I get?
Oh, and hey, best
Sorry, y'all. I'm
see them as they're coming in. Hi,
okay. Let's see.
Jessica.
Okay, so let's see. Nathan.
He
He just says hello. What's up? Yeah.
I did.
I'm trying to show him on the screen.
So proud.
Okay. Hold on, Michelle. Let me get to Michelle's comment. 1 second. Michelle says, "What do you anticipate phase 2 to look like? Will we be on lockdown again, or do you foresee us being more prepared like we are for the winter flu?" Well, in Michigan, I'm not sure where you are. In Michigan, we're actually in phase 3. But if you're talking about the second wave, everybody's saying it's going to be worse than the first wave. What do you want to add to that?
Well, one thing I'll say that I hope that in lieu of everything that we're currently experiencing, that we are preparing now. I mean, when you're in a storm, you're in a battle, and you're kind of seeing what you're potentially up against, then the preparation even now is so key. So, what we've been implementing now would still need to be implemented, and hopefully, like, our CDC and our World Health Organization are also doing further research to help us further combat this. But it also kind of makes you think about, too, moving forward, still, even I'll just say a year from now, still, are we going to still need, these protective measures still involved? But will we be on lockdown again? It's possible if that second wave, is worse, than the first. It's possible, we're still really just navigating through this virus to really see the best ways. But what we do have now implemented is something that still needs to carry over. Plus, prayerfully, any new measures that could, help further prevent the spread. Okay, Autumn has a question. It says, "What are your suggestions to families who are constantly allowing other members to visit or vice versa? I know so many people are still visiting other homes and excusing it because they're family." We love our family. A lot of us, we love our family. We love our family friends. We love that sense of community. But it's still imperative that as much as we love our loved ones, because we love our loved ones so much, that we do our due diligence by protecting them. So it's so important that, in lieu of Mother's Day, for those who don't live directly in the household with their mother, FaceTime your mom, text your mom, send her a video message, or whoever that mother figure is to you. But it's important just to, even with our loved ones, that we have to love them from a distance right now. I know a lot of us miss that physical, but same thing. We have to treat our loved ones still at a distance for right now as best we can. I know there were a couple questions.
Let's answer. Let's answer. I know I kind of breezed through them. And if we don't answer your questions on the screen, we'll circle back and answer them once I can. Angela, she says, do you feel everyone will eventually be exposed at some point? That's always been my position, because I just feel like the virus is spreading. What can stop it? You know what I'm saying? Nothing is going to stop COVID-19 until we have a vaccine, or it just weakens. That's normally how viruses do, right? You know, they just keep going and keep infecting until they just eventually weaken and die out. And you know, we're not at that point right now, so it's just going to keep spreading. And the whole keeping us in the house, really, that's just like slowing it. Once you send us back out, you're going to have all these high cases. That's why you see, like, you know, Georgia, some of their cases, I mean, it's inevitable. Like, it's a surprise. People are like, see, they shouldn't have let them out the house. I mean, you can't really keep people in house indefinitely, because we waited too long. They waited too long to, you know, implement all these different things. So if we would have been in the house, you know, after we had like our first 5 cases, you know, everybody in the house, so these 5 people, you know, can't keep spreading it, because, you know, like one person can affect 3, those 3 people affect another, you know, and it just grows like that. So if we would have, you know, contained it when it was like maybe 4 or 5 people, but now it's like what, almost 2 million people in the USA with, you know, coronavirus, so that are positive for coronavirus, whether it's severe or whether it's mild. That's a lot of people. So yes, that's why we're in pandemic mode. You can't really, you know, so I don't know. That's just my views. What do you say?
You know, it's so imperative. Oh, hold on. I need to move my camera around. I got some background, but it's so imperative that, you know, it's so imperative that we do our best to stay, to still distance. I mean, it's possible that we could still, be exposed to people that, you know, have had it. I mean, essentially us going around even now, we don't know who we've been exposed to. So it's possible. Yes, imperative.
Trevor, he says, are these homemade masks people are making from YouTube tutorials patterns sufficient for wearing out in public? You want to go ahead and answer that? Are these YouTube?
You know, it's one thing I'll say about personal protective equipment, PPE. You do want to be careful. I mean, that's a whole kind of another topic if we dissect, like, you know, N95 and KN95 masks. There's a variety of masks that you're seeing. You know, some of these masks necessarily are not used in healthcare facilities. I mean, the N95s are, but the KN95s and some of the other masks are a little bit different than the respirators that are used, the respirator masks that are used in healthcare settings. But I would just caution, you know, on some of the things that you see on, you know, YouTube. You know, a rule of thumb, I would at least go by the guideline of what we're seeing with the CDC and WHO, as far as if you take a bandana or you're taking, I have seen the shirts, you know, you're seeing the fabric, but you know, if you're kind of leery about it, I would suggest don't buy it. If you're questioning if it's really going to protect you. So I would be cautious if you're seeing a lot of pop-ups with different types of masks and things like that. I would be cautious with what you buy and purchase and buy.
Okay, so we're going to take this last question here. If you guys have any more comments, you can, you know, drop them and we'll come back and get to them. But let's go ahead and answer this before we end.
So this is a good question. It says, married people, should we abstain from kissing to prevent spreading the virus, whether symptoms are present or not? You know, that is a valid question to make. You know, when you are kissing someone, you are putting yourself obviously at a risk because your mouth is right with that other person. So I would say you would have to use your personal judgment. I mean, I can't tell people they can't kiss, but I would definitely, I would be still be careful and cautious, i- with kissing your partner. I mean, if you know that that person, hasn't been around a lot of people, it's just
I mean, in that situation, it's really personal. As like healthcare, we really can't give you, we can give you an opinion on that. I mean, personally, you may just both want to go get tested and just make sure we're good. But like we said, testing is only a moment in time, or you can get the antibody because that will tell you that you've been exposed to it. But you can get tested if both of you guys are negative, and just kind of use discretion. But I mean, if we're going to go by, what the guidelines are, then no, you know what I'm saying? You wouldn't want to be kissing because that's like the number one way it's spread, through droplets, and droplets come out your mouth. So, if you're kissing and stuff and this person's going to work, this person's going to work, this person's going to, all these stores, and you could be asymptomatic. So maybe just kind of kiss on the cheek or, the forehead, or just hug and, do some other things. I mean, I don't know, because if one person's asymptomatic, but they have it and the other person is negative, then, or you can just be like, what, ride or die, whatever you got, I got. I mean, I don't know. But yeah, just until like people could at least get vaccinated, I wouldn't maybe be doing so much kissing. But that's a cute question though. But yeah, so just leave everybody. Oh my gosh, like this was huge. Like we normally do these things and they're only an hour. Clearly we went over that, but you guys were so engaged. We appreciate everybody, staying with us throughout the whole broadcast. All your questions were, very thought-provoking. So leave everyone with some tips, as a nurse, share your nursing tips, to keep people healthy so they can decrease their chances, if they get COVID-19. Give them some tips.
Okay, so my nursing tips for the public would be, number one is our hand hygiene. Our hand hygiene is so imperative and important in protecting ourselves from spreading disease and from contracting diseases. So it's so important that we're washing our hands with soap and water. You can say the happy birthday song. If you don't know to like keep your hands underwater for 20 seconds, but hand hygiene is so important. And also using at least a 70% alcohol-based hand sanitizer. So it's important. So number one is the hand hygiene. Number two is, I would say, protecting, your mouth when you're going out. Make sure that you have some type of barrier. If you do not have access to a medical mask, a surgical mask, use a bandana, use a hair scarf, use a t-shirt, use something. Specifically for those that they know they don't have access to that. It's imperative to use.
You want to do the mask real quick? Since you're talking about masks, you want to do the mask thing real quick?
Oh, sure. So
she's gonna do a little demo with the mask. Now, initially they were saying, the public can't use these surgical masks, but clearly we see people using the surgical mask. I mean, at this point, the hospitals are good. You know what I'm saying? Like they have. Yeah, so I mean, if you have access or you want to go buy a surgical mask, then, but the N95 mask, you guys should leave those for everybody at the hospital. But she has a surgical mask. She's just going to do a little demo. So go ahead real quick.
Yep. I just want to say too, with the surgical mask, the one that I have is blue. A lot of times we're seeing the blue or the yellow ones. And for people, always know that the color side should be away from you. Just as a little tip for masks, always know that the color side is out. So if people are wondering which side to wear, make sure that your color side is facing away from your body. But when you have a surgical mask, wash your hands first. Number one, make sure your hands are.
Well, wait, real quick. Is it okay to switch it around? Like sometimes wear it this side and then switch it around the other side.
Wearing it the proper way, because the way that the masks are manufactured, it's important to wear it the way that it was designed. Because if you flip your mask the outer layer, which is usually thicker, is going to be on the inside. And the whole purpose of the mask is to really help protect, any of those droplets from coming in. So when you do have a medical mask, it's so important that you're wearing it properly. So please don't flip it inside out, everyone. Wear it the way that it was made to be worn. But I just wanted to throw that in there about the colors in case people were wondering, well, which side do I wear it? The color side. But know that. So when you do have on a surgical mask, wash your hands first if you can, hand sanitizer. But when you're putting on your mask, it's important that you keep it in your one hand. And when you put your mask on your face, you want to make sure that you are, fitting it where there's a like a little metal piece that's in the mask where you can fit it to your face. And then you want to make sure that you're putting the loops on the mask. And then you want to make sure that it's pulled down properly and that it's covering your nose. And you want to make sure that you've fitted the mask properly to your face. So that's really important. I also want to stress too, when you're taking off your masks and you're throwing them away, don't touch it from this part, the front part. Remove your mask from, the ear loops. And you can turn it inside out and throw it away. But because any yuck or anything that's been on the top of the mask, you don't want to put all that on your hands. So just a little.
But here's the thing. But here's the thing with that. You say don't touch the outside of the mask. Mm-hmm. But if something's gonna get on you, like what if it's in your hair, or what if it's on your shoulders, or what if it's on your shoestrings or anything? So why is it so important to don't touch the outside if those same droplets can fall anywhere else and you touch it?
Well, it's important because if you're using your hands to touch it and you want to keep your hands clean. So it's important that you're not touching what's on the outside and further, contaminating, cross-contaminating, spreading anything further. So that's why in healthcare, there's proper ways to put on masks, take them off, put on gloves, take off gloves. I know we're not getting into those details, but for people that wonder about those things, when a lot of us healthcare workers are expressing what we've learned and some knowledge to you, there is a reason why you properly you don and, take protective wear off. So that was my tip was the hand washing, was covering your face, and also, the distancing, making sure that anything that you're doing right now in this season really is more of a necessity when you are going out. Use wisdom and use good judgment when you're making decisions to go out. Now is not the time just yet to do a lot of socializing. So, and just keeping your body as healthy as you can, exercising, eating a balanced diet, drinking your water, taking your vitamins, also protecting your mental health too, because that's so important. It's not just the physical health. So keeping your stress levels down as best you can, for those who are praying, continue to pray, continue to meditate. Those things all are all essential in protecting ourselves and our loved ones. So those are my tips. There's so much more that you said, but that's what I would sum it up in.
Yeah, no, that was good. Oh my gosh. Thank you so much for joining me tonight. You've just been a wealth of information. Have to do this again, hopefully. Yeah. But so I'm gonna tell everybody how they can find you.
Yes. Okay. So on social media,
your business real quick. Tell them about your business.
Yes. Okay. Well, I first also want to say thank you to Charmaine. Charmaine is just a wealth of knowledge. She has so much experience and knowledge in the nursing world. And it's so nice that we were able to connect and over the years.
I know this was
fun. So thank you so much for having me on tonight. But so my business, I have a baking business and it's called This Girl Bakes. And my Facebook page is This Girl Bakes 2911. And so you can follow me on Facebook and on Instagram under that. It's all one word. And you can see the different items that I bake. I make everything from scratch. I will say though, disclaimer, I have an influx of orders right now. So I am not taking any new orders right now. I am already full into the month of July. And I just appreciate appreciate all of the love and support. I can't take any new orders, but for those of you who I have been in contact with, I have your information. I have not forgotten you, but you can follow those outlets of my business. And as far as my nursing page, I do have an Instagram page. It is Miss Black RN, MISS BLACK, the letter R, the letter N, all lowercase. And you can follow me on my Instagram page. And I just try to share knowledge that I have and on that outlet as well. So those are ways that you can reach me on social media.
All right. All right. Well, thanks again. And thanks everyone for watching. And we'll see you all the next time. All right. Have a good evening.
Thank you, everyone.
Bye.